You know those conversations that you have at conferences, back in the days when we still had big vet conferences, when people are chatting to the lecturers and asking questions, and you hear things like, "This isn't really in the books, but here's what I think." It's in those kinds of conversations that the best nuggets of wisdom appear, the nitty-gritty real-life details that you can only get from years and years of experience. And it's exactly those kinds of conversations that we try to emulate on the Vet Vault Clinical Podcasts. We don't want lectures. We want to hear about the challenges, the tips, the stuff-ups, this is how I do it. Go to vvn.supercast.net to join in the conversation.
Good evening, ladies and gentlemen. This is Gerardo Poli.
And this, sorry. Okay.
I'm Gerardo Poli.
I'm Hubert Hemstra, and this is the Vet Vault. Hello and welcome back. The interview for this episode is a little bit different in that it's just me, no Gerardo, because Gerardo had to rush off last minute to take some poor dog spleen out as we started recording our episode. So as a punishment for saving some dog's life over doing a podcast with me, he is going to do the entire introduction by himself. Okay, go.
Thanks, bro. Hi, team. Our guest today is a legend in the animal behavior medicine world. Dr. Sarah Heath is one of an instrumental group in the United Kingdom who worked very hard to get animal behavior recognized as an actual science and a specialty in its own right. As you'll hear in the interview, she started working in the field in the days when many people believed that animals had no real emotions, which shockingly was not all that long ago. Thank goodness for Dr. Sarah and her colleagues, right? Now, before you think, I have no interest in behavior, so I'm not listening, don't make that mistake. This conversation starts off around animal behavior, but goes way beyond that. Sarah's a rock star when it comes to connecting with clients in difficult situations, for example. So there's something here for all of us. Hubert does a fantastic job. I'll leave that in there. Hubert does a fantastic job chatting to Sarah about behavioral medicine as a career path, the pros, the myths, the challenges. They tackle topics like when the vet becomes the counselor for the client more than for the patient, which is a phenomenon that I'm sure many of you are familiar with. They talk career longevity, client connection, grieving cats, self-care, and much, much more. Please enjoy Dr. Sarah Heath.
That'll do, pig. That'll do. Now, before we start, I just wanted to give a quick shout out to a few of our listeners who've reached out to say hi. Dr. Sheena White, Dr. Susan, Dr. Bernie, whose surnames I don't even know because it's Instagram, Dr. Ivan Duan, and Nikki Griffin, who's actually a student at my old vet school. Thank you so much for getting in touch over the past few weeks. I love your feedback. Sheena and Ivan, or Ivan, thank you for supporting the clinical podcasts. Thank you from the bottom of my heart for taking the time to reach out. It makes my week every time we get a message like that and inspires us to keep having these conversations. You guys are legends. Now, onwards. Welcome back to another episode. We are very privileged to have, I almost said doctor. I always do this to the British doctors. Sarah Heath, but I want to say Dr. Sarah Heath to give you a title. Are you a doctor of any sort?
No, we are now.
You are doctors.
It changed, yeah. So it changed a couple of years ago. So vets are now doctors in the UK, yeah.
Okay, so that is okay. We have Dr. Sarah Heath,
but only in a professional context. So it's you only use it if you've got your RCVS or what your Royal College membership after your name. But you can't just use it all the time.
Okay.
Professionally.
So you're not booking flights under Dr. Sarah Heath.
No.
Okay, no. Makes sense. Well, Sarah, thank you so much for joining us. I really look forward to picking your brain, and it sounds like it's quite a brain.
Oh, don't know about that. Anybody's got a brain left after the 2020 experience?
Goodness gracious, yes, absolutely. Sarah, I've got to start with this. I was doing some research on you, and obviously animal behavior is the big thing. And I did think to myself, I bet you she has the worst behaved pets in the world. Have you got badly behaved pets, or are they actually really impeccably behaved?
I'm really, really fortunate that I have two adorable cats who are pretty good, actually. So yeah, I'm dogless at the moment. Sadly, I lost my flat coat to cancer, as most flat coat owners sadly do.
Yeah.
And so I'm between dogs. I was supposed to get a new puppy in June, but COVID came, so I didn't get a puppy. So I'm due a new dog in 2021 if all things improve. So another flat coat. And sadly, just until literally 2 weeks ago, I had 3 cats, and then sadly Sammy was run over 3 weeks ago. So yeah, they're very traumatic in our household at the moment. So Sammy was only 3 and leaves behind his 2 litter mates. So one of whom's fairly traumatized because he saw it happen. So yeah, road traffic accident outside our house. So it's all been a bit traumatic.
I'm really sorry. That is very traumatic.
Oh yeah. So I have 2 cats now, and they're lovely. I can't complain about their behavior at all.
You know, it's not meant to be a clinical podcast at all, but I am curious. Is there a change in their behavior since the accident? You say Sammy, that he's traumatized because of what he's seen.
Yeah.
Have you noticed it?
Oh yeah. Sammy saw it happen and was absolutely terrified, and has taken a long time. So yeah, he's struggling actually. He's still not going out normally. He still wants to be where people are. So it's only 2 weeks, it's early days, but yes, very definitely noticed a difference. Yeah, he's really struggled. Yeah.
Oh, that is tough. It's such a common question that you get in practice, in general practice as well, when there is a loss of a pet, and the owners are always very concerned about the other pets, and they want to know, what can you do? My answer has always been that they are pretty resilient beings. They generally deal with stuff better than most humans. But is there something specific? Is there something that you've been doing differently to yours?
Yeah, definitely. And I did actually use I am still using a nutraceutical. Nutraceuticals are a little bit out there in terms of whether there's enough evidence, and we certainly don't have a strong body of evidence in terms of placebo-controlled trials or that sort of thing behind the nutraceuticals. But the theory of them is that they enhance dopaminergic and serotonergic activity, which would be beneficial at this time.
Mm-hmm.
I haven't gone to the point of medication, but I have had patients in the past where the grief has been long term and it's been going on for months, and where we do sometimes use Selgin, which is a monoamine oxidase B inhibitor, which is dopaminergic in action, because dopamine levels are depleted when you have the grief response. So it can be beneficial to give the medication if it's sustained over a period of time. Certainly, I haven't done that with Louis, just using the NutriCalm at the moment. And also just trying to, give him a bit of support in terms of going out and making sure that there's someone around at the moment, and then gradually, hopefully, get more confidence back.
This is very interesting. Like I said, this podcast, we talk about non-clinical stuff, but I think we're going to have to get you for some clinical podcasts as well, or doing on behavior, because I'm instant. I just want to keep asking, but I'll detour from the actual pet advice. I want to ask more about the career and the profession and behavior as a profession. Talk us through your journey first of all. So vet school, and then what did your first couple of years look like to get you to where you are today?
Yeah, my story is quite a complex one, in that I never intended to be working with small animals, never mind specialised in something. I was going to be a dairy vet. I come from Cheshire, which is a part of the UK which is very, very dairy. Mm-hmm. And although we have no farming background in my family, I spent my childhood on farm holidays and then started working on a farm as soon as I was legally able to. Okay. So it was totally dairy. That's all I ever thought about. And I applied to vet school to be a dairy vet. And and here I am, very much not doing dairy. But I did start my career in mixed practice, primarily large animal. So 70% large, 30% small practice that I went to after I qualified. And I spent 4 years there, 4 very happy years there. And I do have sheep of my own, so I do keep the sheep thing going. So you've got to have some experience of larger animals. So what happened? Basically, I was driven by animal welfare, really. I always say I've had 3 very influential people in my life as far as my career is concerned in terms of behaviour. One was Len, who was the herdsman at the farm I worked at when I was a teenager, and he and this doesn't sound that remarkable now, but remember this was 40 years ago. And he used to talk about the cows to me in terms of how they felt about things. And if one of them was late coming into the parlour, or milk was down, or one of them didn't lie in their usual cubicle, he would always want to know why. And he was always, there must be a reason. She never does that. She would never do that. That's not normal for her. Something's wrong.
Yeah.
And all his thinking was very much about them being individuals and about them having feelings, which again, as I say, was something quite unusual at that time. So that started me on that path of animals have emotions. They have emotional responses. It started as early as that, really. And then I had a very influential person at college. My large animal medicine lecturer was a man called Jim Pinsent, who was a phenomenal vet, phenomenal human being. I owe a lot to him in terms of just learning about life and about the art of veterinary medicine, something that Mr. Pinsent really believed in, that it was a science, but there was also an art, and that you needed to always remember that. And he also had that feeling that there was this other dimension to the non-human animals we were working with. And then I had a fantastic boss in my first job, Peter Waite, who also had more of an inkling of this other dimension. And it was him who actually was using someone called David Appleby as a behaviourist at the time, coming into the practice. And again, thinking that I qualified over 30 years ago, it's very different, to now. And it was unusual for a practice to have a behaviourist coming and giving advice to dog and cat owners about their pets. And I was fascinated by this branch into small animals of what I'd already become familiar with in terms of welfare in larger animals.
Yeah.
So that really was the beginning.
Awesome. That is quite extraordinary. You say it doesn't sound, but you're right. With that was it Len who was wondering about the feelings of the animals, because even when I studied, it's not all that long ago, although it's starting to get longer, 20 odd years ago now, 25 years until back to my first lectures. But when we did animal handling, I remember one of our lecturers saying, be very, very careful of putting emotionals into animals. They don't work like that. So they were almost trying to tell us, don't buy into that bullshit. Animals are just, and a career in animals makes you think, of course, that's not accurate. But when did that thinking change? Is it because it does seem quite recent, or has it changed? Are there still scientists who say no, you're barking up the wrong tree, or is it widely accepted now that there is a
been a very slow evolution, I think, over time? And as I say, there were people right back when I was a teenager who did believe that and were saying that. So it's not a new thing. But you're right, there was a body of science that didn't accept that. And I think it has been a lot more recently that people have actually taken this much more seriously and actually gone, do you know what, non-human animals do have all three aspects. I talk about the health triad. So as we do in human medicine, so having emotional, cognitive and physical health that all interplays with each other, and they all affect one another. And that has gradually become more accepted. But Jack Pangsep, who was a Estonian biologist who sadly died a few years ago, too young, but he was probably one of the turning points when he wrote his book about effective neuroscience, when he talked about emotions in humans and non-humans, and talked about the fact that these systems applied to non-human animals as well. And so I think he was a big turning point, but I think it's been a gradual evolution, and there's been many different people along the way who've contributed to the increased understanding. But the veterinary profession is slow some ways. I love the profession. I wouldn't do anything else. It's the best job in the world, but it does have a little bit of a tendency to be a bit resistant to change, and takes a while to get on board. So yeah, I think unfortunately the vet profession has been a little bit late to the party, really, in terms of understanding that animals have this triad of health issues and triad of aspects to their health. So there's a lot of work done in animal behaviour outside of the veterinary profession, possibly before the veterinary profession really took it seriously.
So we were just focusing on we as a profession on the physical aspects, very much ignoring that aspect. Now this is skipping ahead through your story, and I want to come back to your story. But you talk about that resistance to change within our profession. Now you are one of the, am I accurate in saying you're one of the earliest people to actually treat animal behavior as a science within veterinary science, as an actual specialty? Is that accurate? You helped to establish it as a field of specialty?
Yeah, that basically I'm old is what you're saying. I'm old. Yeah. But yes, yeah, absolutely. Along with several other very, very important people in the field and dear friends and colleagues as well. So obviously there are many people who contributed to it. But I did in 2019 was awarded a fellowship of the Royal College for recognition of the fact that I established veterinary behavioural medicine as a discipline.
And was there a lot of that resistance to change when you started with this, when you were starting to make noise about behavior as a specialty? Did lots of people fight you for it?
Oh, yes. Yeah, I remember right at the very beginning, because I obviously spent a lot more of my time with non-vets in terms of behaviour, because there weren't vets doing behaviour at the time. And I think the profession would have liked to have put me in a straitjacket and put me in a padded cell for a while, really. And then gradually, they start to go, oh, maybe there's something in this. So, yeah, I mean, things have definitely changed hugely. Although, sadly, I was just talking to a colleague of mine in Belgium who's another one of the early people in the field. She was just talking to me yesterday. We were having a social chat, but we were also talking a little bit about work because we're vets and we can't talk about anything. But there's a bit of a vet disease, isn't it?
Yes.
But we were talking, and she was just recounting a couple of cases she'd seen recently where other people in other disciplines had dismissed her concerns about pain in these particular patients and basically told the client, no, there wasn't any pain. And my colleague didn't know what she was talking about. And that is the sort of thing that does still happen, sadly, with a lack of respect for behavioural medicine as a discipline. We do still have that experience, sadly, that sometimes people don't see it as a valid discipline and dismiss what we say, even though, and also dismiss what we say about other aspects of physical health, because behavioural medicine is not just about emotional health. Behavioural medicine is recognising the triad. We talk about emotional, cognitive and physical aspects. We diagnose chronic pain on a daily basis in our patients. We diagnose, Cushing's and Addison's disease because we see the behavioural manifestations of those disease states. So it's a constant thing that we are diagnosing physical disease, suspecting physical disease involvement all of the time. So it's not that you step out of the physical disease to work in behavioural medicine. That's not the case. It is a discipline that involves physical health as well. But I think the recognition is not there of that aspect of behavioural medicine.
Okay. Why do you think there was and still is to some degree some of that resistance in seeing it as as one of the real, let's say, one of the hard sciences of veterinary science?
My flippant answer to that is we're not an ology. So you need ology on the end to be
behaviorology.
No, but seriously, I do think the word behaviour is a problem because, I mean, we call it behavioural medicine in the UK and across many countries. There are some countries that call it veterinary psychiatry, and there was a lot of resistance in the UK to using that term. And I think it was right to be resistant to it because it's a very loaded word. In the UK, a psychiatrist is still, and this isn't true, I've got friends and colleagues who are psychiatrists in the human medical field, and they do not just give out medication. That is not true. Yeah. They do exactly what we do. They look at the interplay between physical and emotional health. They very much are still doctors, and they're not just people who send out medication. But there is a view of psychiatrists that that's what they do, that they literally just medicate people. And there was a danger that was the implication as well in veterinary behavioural medicine, that dog trainers and people who are non-veterinary clinical behaviourists, that they did all of that sort of stuff and veterinary behaviourists just gave out pills. Yeah, okay. And that is not true. Yes. And it's certainly something that we had to really fight against, in recognition that it's just a discipline that's all about medication. And as I say, it's education about that. So I think a lot of the resistance came from the fact that it wasn't seen as being a whole discipline, as sort of involved as it is. And I remember some good friends and colleagues, people I qualified with, jokingly saying, "Oh, have you had a tough day choosing between those two licensed drugs?" There's not a lot to your job, is there? That sort of banter going on as well. And I got asked, and I still do get asked, "Do you miss being a vet?"
Oh,
so
wow.
many times. people say, do you miss being a vet? Don't you qualify as a vet and then you do behaviour? It's like, no, I do veterinary behavioural medicine. I am a vet. I am no less a vet than anybody else out there in the profession, whether they're in industry, research. We're all vets, you know. I have not given it up. But there is this concept of, oh, you stepped out of the profession. No, I didn't. I just stepped into a different discipline.
Absolutely. Behavior is one of my favorite specialties, and I don't mean doing it. I mean the fact that you're there. So those really complicated cases you can actually ship off, because I find them really challenging. For that reason, it isn't just medication. It's really multifactorial, and you need a lot of time and a lot more brain, I think, than I have for dealing with these. Going back to your story, though, we skipped right ahead. But so now you want to be farm vet, and then you develop this interest in behavioral medicine, animal psychology, behaviorology. Let's call it that. Then we'll start on this podcast with turning it into ology. So what next? How did you make that transition? How did you turn it into a career, especially when there was no such field?
Yeah, well, because Peter, my first boss, was already interested, and to the point of inviting somebody from externally to do behaviour within his practice, he was really supportive of me getting interested in it, involved in it. And I'm very grateful to my non-veterinary colleagues as well, David Appleby in particular, but also other non-veterinary behaviourists who I worked with in those early days, because there wasn't the support from the profession. I got a lot of support from those people. And I've always been a big advocate of making sure that we have both veterinary and non-veterinary behavioural medicine, so we have vets doing behavioural medicine and non-vets doing clinical animal behaviour working together. I've always been very strongly an advocate of that, and I do believe it's a multidisciplinary field, and that as long as we, what we need is mutual respect. And in the UK, certainly is a big push for this veterinary-led team approach to behavioural medicine, because often in general practice, the time element is not available, and therefore having people who will work on the cognitive aspects of that case, so to actually learning and changing responses, it's really important to work with those people as well and have a multidisciplinary approach, because you may not have the time to do that as well. I mean, obviously now I work in a referral practice that we have a team, so I employ vets and rehabilitation trainers. And so rehabilitation trainers, the rehab part of our team, does the cognitive application of the therapy that's needed. We do the emotional diagnosis. We are responsible, obviously, for medication as well when necessary, but it's hugely a team approach. We also work very closely with physiotherapists, with chronic pain specialists, with neurologists, because it's so multidisciplinary. So yeah, I'm very grateful to the non-veterinary field for supporting me in those early days, for giving me some kind of legitimacy, which I think helped for the profession to also listen as well to the fact that actually there's another dimension to this that means the veterinary profession needs to be involved.
It's a very progressive approach almost to embrace that, the help of non-veterinary things in our veterinary careers, or let's say within the profession. I sometimes get the feeling that we are really quite protective over our, it's my case, it's our field. We don't want anybody else to interfere, and you don't know what you're doing, and we'll do it all. You see it in dentistry. I don't even say dentistry. I'll get the equine vets all up in arms. But it's certainly, there seems to be that you need a veterinary degree to do anything with this. It's a lovely approach. I like that.
I think the other area that, obviously, as someone working in behaviour, the other thing that I do on a daily basis is chronic pain management, because chronic pain is such a massive part of behavioural cases. And so we do all our chronic pain management in-house in our practice. And through that, I've worked very closely with people like Dr. Matt Gurney, Dr. Gwen Covey-Crump in the UK, really amazing anaesthesiologists and analgesic specialists. And they've done so much to help us as a practice improve our understanding of the work that we do in that area. And that has led us to work with physiotherapists. And so, again, a multidisciplinary approach that actually we need to work with other people to give our patients the absolute best quality of care that we can give them.
Yeah, it's almost recognizing your limitations, not so much on what you can do, but just time-wise, is actually getting rid of some of the jobs, and so that you can focus on where your maximum value lies for the patient and in the business, I suppose.
It was making sure that their welfare is protected in every level. So yeah, absolutely. So it starts within the practice in terms of our multidisciplinary team, but then also, as I say, we also work very closely with people outside of the practice as well. So Matt Gurney, as I just said, in chronic pain management, and then Dr Claire Rusbridge, who's a neurologist who we work very closely with as well. And we actually do multidisciplinary rounds with her. So my residents, I've got 2 residents who are doing their residency for the European College of Animal Welfare and Behavioural Medicine, and then Claire Rusbridge has residents in neurology, and so we have multidisciplinary rounds together by Zoom so that we can discuss cases. And I think that, again, is really important, that the residents are learning how important it is to work with other disciplines.
Yeah, it's a valuable lesson. So your journey, it doesn't sound like there was a seminal moment, like a light bulb moment when you went, okay, I wanted to do behavior. It sounded like you started on a path and just kept digging in it, and you started getting deeper and deeper into the field that actually built this field around you, which is an incredible story. Different story these days. These days, it's a well-established, as you say, it's not an ology, but I know many people who love it from university days. If one of our listeners is out there thinking, okay, this is what I want to do, I love it. What does the journey look like these days to get really into the behavioral field?
Well, I think obviously it depends where you are in the world, and you've got people like Kirsty Sexel and Jackie Lee over there who are specialists, who I'm sure will be able to advise you better about the route in Australia.
Yep.
Certainly in the UK, then our route is, first of all, usually a master's level qualification after vet school, because there are a couple of masters now available in clinical animal behaviour. They're not vet specific, the master's level, so you will be mixing as well with people from other disciplines, but I think actually is a benefit.
It's a good thing, yeah.
So that's the master's level. We've got 2 in the UK, one at Lincoln and one at Edinburgh particularly, but we have other courses as well that offer different aspects of clinical behaviour at that sort of level. So, but those are the 2 master's levels ones that I'm most familiar with, and again, it's personal experience as well. The vets I employ here at Behavioural Referrals have all done the Lincoln Masters, so that happens to be the one I know most about, but there are others. And basically from that, the progression within the profession is that the Royal College, and this is a massive step forward, now has advanced practitioner status in behavioural medicine or in companion animal behaviour. So you can become an advanced practitioner level, which I think would be the equivalent to something like your membership over there.
Yes.
So as I say, I'm talking from a UK perspective, but the advanced practitioner status has become well recognised now, and there are a lot of, it's really increasing numbers of vets now getting advanced practitioner status, and that's brilliant because they can then do behaviour within their practice. They can take referrals from local practices as well. They're not specialist level, but they have a great contribution to make to the behavioural field and to making sure that behavioural field is recognised.
Yeah.
Then the next thing, if you do want to take it further, is specialist level, and that would be a residency in the European College. So there's the European College of Animal Welfare and Behavioural Medicine. Obviously, you've got your Australian and New Zealand college over there. There's a college in America as well. So there are, in different areas, it will be different colleges. But the European College residency programme is the next step to working towards your specialist status.
And the career, or let's say that the working life of a veterinary behavioralist, often we have these ideas of what, before you set off on a journey, on what life looks like, and often a romantic idea of I'm going to do this and that. Are there things about your job that you think people have a misunderstanding about, that they believe or think that's there, that is completely different, whether it's good or bad?
I guess the best example of that, which has both good and bad, is the interaction with humans.
Mm-hmm.
Because the animals we deal with are companion animals. They have a caregiver involved in their life, and it's a bit like, I know I talk to my human colleagues who work in child psychiatry, and it's very similar, that they have a parent, a caregiver, who is responsible for actually engaging with the advice understanding what needs to be done and actually doing it, because we're not at home with them, we're not there, we don't give the medication, we don't do the behavioural modification program, we don't change the environment. It's the caregiver that does that. And that is a very positive thing, because you get to know people. And one of the things I love about this job is that I get to know people at a really deep level. And I often speak to the general practitioner who's referring after I've seen a case, and we're talking about stuff, and they go, I've known that person for 20 years and I didn't know that. Because you don't get that depth of interaction with the caregiver in general practice. Of course, you get to know some very well over long periods of time in general practice, but you often don't have those deep conversations, and you don't get to know the whole family, the whole setup. So it's a very personal thing in terms of your connection with them as human beings, which is something I like, but can also be challenging at times. And we sometimes say, you know, if I'm going to do another degree, I think I should do one in social work, because probably that's one of the things that we do spend a lot of our time doing. We're social workers, because we do need to work with the emotional impact of this. These issues really impact on the family. They impact on the animal's welfare, but they truly impact on the welfare of the humans who live in that household as well.
Yeah.
And so, yeah, it's a positive and a potential challenge at the same time, really, I think.
Yeah. Do you find that what you just said there about the behavior problems impacting on the families, does it go both ways? Do you see a lot of animal behavior issues arising from families or individuals that are not doing well emotionally?
Very, very definitely. Yeah, if you have a challenged household in any aspect, then all members of that household will be affected, whether they're human or non-human. They're going to be impacted by the environment that they live in, whether that, you know, that social environment. And I guess people who are familiar with my work, I developed the SYNC model of emotional health in companion animals. And that model talks about the fact that we all have this SYNC, which is about our own emotional capacity. But when you live in a group, then those syncs are interconnected. And so, you know, one person has a very, very full sync that has an impact on the other individuals living within that group. So you can't be looked at in isolation. And I guess that's one of the things that's complex about what we do, because I saw a case last week of 7 dogs in a household. So one dog has an issue that the caregiver has brought to the attention of their GP. But actually, in order to diagnose and deal with that one dog, I've got to assess all 7 or the other 6, because they impact on each other. You cannot look at one dog in a multi-dog household or one cat in a multi-cat household in isolation from the other individuals that it lives with, because so often we find the one that's having a behavioural presentation that's challenging to the humans, so that's the one that gets referred, actually from an emotional point of view, from a health and welfare point of view of the individual, maybe suffering actually the least out of all of them, and that we've others in that group who have got far more serious emotional health issues, but they are not demonstrating behaviour that's challenging to humans. So therefore they've been overlooked from a human perspective, but they're impacting on that other animal who then gives a presentation that is impacting on people.
So it's the squeaky wheel scenario.
Yeah, absolutely. Yeah, that's the one we see as problematic. But actually, if we look at the whole household, we find out that actually, oh no, that one has got problems. But boy, oh brother, if we don't look at this one, we're never going to make progress with that one. And it may be that sometimes that the one we need to make progress with is a human, not a non-human. But obviously, that's not my job. And our job then is to just advise that people seek help from appropriate channels for themselves, because if we don't improve the quality of life and the welfare of the humans living in that household, we equally may never make full progress with the non-human animal either.
Okay, that was I'm sitting here thinking, wow, your job is very complex, because you have that human component. And I always knew that behavior, there's the running joke, you're training the humans, you're not actually training the animals, but I haven't considered that it often is a consequence of humans having emotional problems. But you say you don't actually deal with that, you recognize it and you're recommending. Okay.
So what I would always do is talk to them. And in fact, so many times myself and the other vets in my practice say that, you know, at the end of a consult, I had one a few months ago, and the lady said to me at the end of the consult, she said, "Thank you so much for all your help with the dog, but no one's ever listened to me like that." So that's also our job, is to allow them to be able to speak and to recognize and to say, that's relevant. I can't help you because I don't have those qualifications, but there are people who can. And I really urge you to try and tap into those sources, because you deserve that help as well. And yeah, it's important to recognize that.
Is it a challenge sometimes that, I'll backtrack. Even at GP level, many vets sort of tongue in cheek complain about the fact that people often come in to the vets for their own emotional sessions, so they can offload all of their problems onto the vets, and we have to play the role of psychiatrist in the background as well. But I would imagine, or is it more of an issue within the behavioral field? Do you find that clients try to cross that boundary more of coming to you for support for themselves, and the animal is almost a proxy?
I wouldn't say the animal's a proxy. I think there genuinely are concerns about the health and welfare of the animal. But sometimes when I'm explaining, and all of us in the practice, when we're explaining about the emotional health of their animal, so many times they go, "Oh my goodness, you're describing my son."
Oh, wow.
That explains why my son does things. And then you say, "Oh, obviously I'm not involved, I can't help you with that," but there are people who can. So if you feel that he needs help, then please ask someone, because there is help available. But often that it's their realization, so they haven't said any of that. It's just as you're describing what's happening with the animal, they're kind of sitting there going, "Oh my goodness, gosh, that's I understand that completely." And either myself or a family member or whatever has challenges in that department as well.
Have you ever been tempted to make the jump to human psychology? Because you no, you're shaking your head quite vehemently.
There is nothing in the world I want to do other than being a vet. I'm just as passionate about that as the day I qualified, which the students often comment on actually at uni, because I teach at a Liverpool vet school, and they often say, "Oh, it's so refreshing to meet someone who's been qualified for 30 years and loves it as much as you do," because so many vets sadly are not quite as happy about being vets 30 years into the job. But I did always say, or have always said, that if someone said I could not be a vet, so if they absolutely said, it's not an option, you can't do it anymore, then a child psychiatrist would be my next level. It would definitely be children.
So, I suppose there'd be a lot of commonality there between the two fields. So that what you just said there about that far into your career and still loving it that much, what's the secret? Why do you still love it so much?
I love the interaction with the unit of humans and non-human animals, that interplay between humans and non-humans. And even in my dairy days, that's what I loved about working with Len, and particularly was that we cared about them. He genuinely cared about them. They were a job. It was an economic, functional relationship, but there was that empathy, and that interaction was very, very important. And that's something I think it drives me passionately. It's not just with companion animals, but also with wildlife and the environment and the world, and this interplay that humans are just a tiny, tiny, tiny part of this great group of living things. I love trees actually as well. But it's that interplay with things around you that I think that this job allows me to do that for a job, which is kind of cool, that you can do something that you really enjoy. Doesn't mean I don't have days that I'm overwhelmed with work, and that's one of the problems with any job. I think any vet, we're too busy sometimes, and it is life. It's not a job, and that sounds like such a cliche. It's not a job, it's a lifestyle, but it is. And I jokingly said, we can't stop talking about it, and even in our general chats we always end up talking about work. But my youngest son, actually, he's 28, and he said to me one day just a few weeks ago, when I saw a cat, and he said, "You're amazing, Mum. After all that time in the job, you see a cat, see a dog, and you every time you acknowledge it, you interact with it, you're pleased to see it, even though that is what you do every single day of your life. But when you see an animal, you can't help yourself. You have to acknowledge its existence, interact with it in some way, and have some kind of pleasure from the fact it exists." So yeah, guess that's it.
That's a gift, and it's great that you get to share it with the world. That what you say about acknowledging animals. There's one of my favorite books. It's a fictional book, but one of the character descriptions of a very nice person. The description is something along the lines of, when he drives down the road, he lifts his hat to dogs in the street, and the dogs smile back at him. And that's just such a beautiful. He's a nice person because that's what he does.
I find it's been really obvious on Zoom actually, and the students have said it when I've been teaching, because I've done a lot of teaching online, obviously, as we all have in this very difficult year. And if I'm talking and I'm teaching, and then an animal comes into one of their screens, I go, "Oh, hello, who are you?" "Oh, we've got a cat. What's the cat's name?" It's like, can't help but acknowledge the fact that an animal has come onto the screen.
Yeah. So I wonder, I'm just wondering out loud, is it a concern for a clinical vet if you don't have that, or you lose that? Like if you get to, let's turn it the question to you. If you get to a point where you lose that, you see an animal and you go, I just can't be bothered. Would that be the sign that maybe it's time for a change?
Can't imagine that ever happening, but but yeah, I guess. I mean, I think the pressures of the job, I don't think we should, it's not all roses. And I don't think it's right to give that impression to people coming through the profession either. Although I desperately want to speak to younger vets about the fact you can still love it 30 years on, and not to feel despondent, because it is a profession with a lot of pressure. And sadly, there is also a massive problem in our profession in terms of the emotional health of the humans involved. And that's a very tragic, sad reality of our profession. And I think something we really need to address, because we are generally, vets are givers. They're people who enjoy looking after others, enjoy caring, enjoy having that. And that takes its toll on you as well. So I think it would be wrong to give an impression that it's all roses, and that I am not very good at self-care as a human being, and something I struggle with, and I have to I have to have other people nagging me and making sure I do, because I fall into that vet trap, very much so. So I think it's important to acknowledge that, and to say to the world, that it is important to acknowledge there's another side.
So have you developed strategies? Have you learned ways of getting better at self-care, or how do you maintain that positivity and avoid the burnout trap?
Yeah, I think it is hard. Yeah, I have hobbies. Sadly, COVID-19 has been a very difficult year, because I'm a massive Liverpool Football Club supporter, and I spend every other Saturday at home games at Anfield, and obviously have not been able to do that. And I've really noticed it. It's a massive outlet for me. I've watched every match on TV since we've had COVID, but that's not the same. And there's a camaraderie about it. We have a WhatsApp support group of Liverpool supporters that we all chat after the game. We have a WhatsApp or a Zoom call after the match to pull it apart, and all of that. But it's not the same as being together at the match. It's not the same as going to the pre-match drinks and after-match drinks and all, having that chatting. And it's just not the same, and I've massively missed that this year. My other hobby is swimming, which again I was not able to do for months at a time this year because all the pools were closed. So yeah, those things, I have found it difficult from that perspective. And I guess the other side of it is that the vets, lot of my very close friends are colleagues too, because we spend so much time working. Our social life is inextricably linked into our work, particularly those of us who are on the international lecturing circuit. So Kirsty, for example, over in Australia, I normally see her quite regularly, throughout different congresses here, there and everywhere around the world. Gonzalo, who lives in Portugal, another close friend, Tini in Belgium. These are colleagues, but friends. And also, you see them because you're working and because you're traveling with work. And that's been taken away this year. You're not getting that networking, and also the mental stimulation of, we've had online conferences, and thank goodness they've been very, very great and helpful, but it misses that social element of being together, because at congresses you sit at the lectures, but then you go out for dinner in the evening, you talk about what you've learned, bounce off each other, and we're all learning. We're all, it doesn't matter what specialist level you are, you're learning every single day. And I go to conferences to speak, and then I listen to the other speakers because I can learn from them, and then that you miss that, definitely. So this year's been a challenge, I think, for many people in lots of ways.
Yes, absolutely. I think we've been so fortunate in Australia. We almost forget that it's happening. A lot of what you talk about there, and it goes back to when I asked about your work as well, and what people don't expect about your work. It sounds like you're talking about connection, relationships and connection, and that. And it's interesting. So many of the vets we talk to on the podcast, and again, we handpick vets who seem to have happy, long, fulfilled careers that they still enjoy years and years down the track. And that's one of the key things. Every single time they thrive on those connections, whether it's with their clients, with their coworkers, and everything else. I would imagine that you would be a master by now especially because you have to get really intimate with your clients more so than a GP vet. As you say, there's that at home setting, and sometimes people, what I've seen in the consult room, they can sometimes be a little bit guarded about behavior issues because they worry that they've done something wrong in that. So you really have to break down those barriers and establish that intimate connection before you can start working at all. Have you picked up tips that let's say shareable tips? I'm sure there's 100 things you do subconsciously, but are there things that you go, look, here's 5 things you need to do to establish a good connection with the client or with anyone?
I guess the first thing is to be open and non-judgmental, and that's easier than it sounds. But I remember students sitting in with me and coming out of the consult and going, does nothing shock you when people are telling you stuff that there's this term in psychology of positive non-regard, that you must always have this positivity towards somebody's information but not give any judgmental information back. And one of my problems is my face. I have a very expressive face. And one of the things I have had to learn is to curtail my face. I'm told that when I'm chairing meetings that I have to be really careful about my face because it gives it away if I'm going, oh, really? Rather than, so yeah, I think that's something I've had to work on is in consults to listen without judging. And that is so important in behavioural medicine because you have to get all the information first and then give an opinion about it. You can't give an opinion about it before you've got all the information, because as soon as you start to give that, you're unfortunately going to close doors potentially, because if they understand the way you're thinking and then go, oh, she's not going to like that then, or there's that feeling that they think that doesn't fit with, oh, what she's just said makes me worry about telling her X, Y, or Z. So the history taking is so important and has to, and even though your mind may be racing ahead, you've probably walked through that door, seen the dog, made an emotional diagnosis already. You're absolutely know what's wrong with the dog, but you can't express that until you've got the information in from the client, because otherwise they won't tell you everything. And even then, there's always that last little twist at the end where they go, oh, and you go, oh, God, I missed that. So how did I not cover that one? So hopefully after so many years of experience, I'm pretty good at getting a comprehensive history, but there's always going to be that little piece of information that takes you by surprise that you go, oh gosh, I missed that. How did I not include that in my question? So yeah, so I think openness, empathy, try and sit in their shoes, because so often you do look at it and go, well, of course. It's like, you don't need to tell me your dog or cat is doing X, Y, or Z. I know it is because I've just walked into this room, and of course it is, because all the clues are there that will be the problem that you're having. But they are the ones living there. They're the ones who are in that household. It's their household. It's their way of life. It's their, you wouldn't do things that way, but that is their way they're living. And so to be empathetic, to try and see it from their perspective, I think is also probably one of the most important things.
Yeah, and it can be a very hard thing. That's one of my, took me probably 15 years to learn that non-judgmentalness and empathy. But at the end of a busy week and a busy day, sometimes it's very hard to be empathetic. But what's taken me a while to figure out is that you think that, okay, I'm so tired, I can't be empathetic anymore. Whereas the flip side actually happens. You go, I'm so tired, but when I'm empathetic, things go easier. The connection's easier, my work gets easier, and I actually get energy from that to some degree. Whereas if you go in there with that, I'm so tired of stupid people, oh, they should have come in last week. And then it just turns your whole day black around you, and you can't, your mood gets darker, and it's harder for yourself.
I think the problem is as well that we are also emotional animals, and we read body language. We don't do it very well compared with other species, but we do it. And I think we need to be aware of the fact that it doesn't matter, how careful you are. If you're genuinely not interested in that person, they can tell.
Yeah.
They know. And if you walk into your consulting room in that dejected down state, then they will know that your heart isn't there, that they're annoying you, you wish they hadn't come, you'd rather be having a cup of coffee. They know that, and then they won't feel understood, and therefore they won't give you the information you need. So your job will be harder, because they won't intentionally do that. They're not going, well, I'm not going to tell you anything then. It's not an intentional thing, but they will hold things back because they don't feel that you want to know. So they're struggling to give you information. So what you just said, if you can, however hard, I'm not, it makes it sound like it's easy. It's not easy.
It's not, yeah.
But if you can, leave whatever it was at the door that just happened and try, or if you genuinely can't, that's where our profession, I think, has to learn that we as employers have to say, it's fine, you don't have to see that case.
Yeah.
You don't have to go to that consulting room. Go and have a coffee, someone else will do it. Because that's what we're not good at, because we're up against it, we're working to tight schedules, so admitting that we are not in the right place is incredibly difficult to do in the busyness of practice and the busyness of our life, and the fact that the client expects us to be top notch 100% of the time, and that we're not. We're human. We have bad days.
Yeah.
Days when we can't just switch it on and carry on. We have to say, no, I can't. But we need to be supportive in our teams of that, so that the rest of us can pick up that somehow. Whereas when we tend to be slightly judgmental, because we all work so hard, we all put in those extra hours, we all stay late, we just expect everybody will be able to do it all of the time. And I think probably that's one of the things the profession
and it's a culture. It's a culture that we get taught at university. It's literally from the day you start, they say, okay, now you can't be soft anymore. Toughen up, get it done, because you're not going to get through exams if you can't just step up. And then in our workplaces as well. And there's that, you don't want to let people down. Like I would hate it in practice to say to one of my colleagues, hey, listen, I can't do consults. I just don't feel emotionally up to it.
Yeah.
So you really do have to have an extremely supportive environment where people feel that they can say that. But you spot on that. What you said before, where the client knows it straight away. In my last role, I dealt with the serious client complaints ended up on my desk. And so many times when I heard these words, it says, I just felt that they didn't listen to me. They didn't even listen to me. And I know that vet's not doing anything wrong, and they didn't intend not listening, but there was that mismatch between, there's just not that connection, and the client just felt unlistened to. And then when something goes wrong, then there's trouble. Whereas if there's a connection and something doesn't go right, the clients will go, that's fine, the intentions were right, but I didn't feel that your intentions were right, so now I'm going to blame you.
That is what Jim Pinsent taught me, the art of veterinary medicine. That's what he meant.
I really wanted to call this podcast The Art of Veterinary Medicine, the Art of Veterinary Science, but Gerardo outvoted me. It turned out the vet felt. But
that's what Jim Pinsent taught to us about as students, and what really, really stuck with me was that you need the science. It's a science, of course, it's a science. We're scientists, but if you don't have that art, then which is the bit that connects you with the farmer or with the horse trainer or with the caregiver of a companion animal, if you don't do that, if you don't have that art, then you can have all the scientific knowledge in the world, but you're never going to be able to convey it. You're not going to be able to have that connection. But one of the things I think COVID has taught us as well, and COVID has been an experience and a half, but is that it's going to change our attitude as well to coming to work when you're sick. Yeah. I remember when I first qualified and I went into a fantastic practice, and it was said a bit glibly and tongue-in-cheek at the interview, but they did say at the interview, albeit slightly sarcastically, we do have a sickness policy. If you have 3 broken legs, you can have time off. So, and that was their attitude. We do not expect you to have time off sick. It doesn't exist. I don't care how sick you feel. You get yourself out of bed and you get here. And that was very much a common attitude as well at that time. And I'm not in the slightest suggesting people should stay off sick for no reason. Absolutely not. But I think COVID is going to teach us that as well, that actually, no, don't risk if you're not feeling well. Working is not what you should be doing if you are actually ill. And maybe we need to expand that to emotional health issues as well.
I spent a lot of time thinking about that when I was leading the team. So it's an after-hours clinic. So there is definitely that, as the guy who had to sort out the roster when somebody phones in sick. If you phoned me a couple of hours before your overnight shift, I'd be in the shit when you call in sick. So I would really want you to come in unless you die. But I didn't like that, because I didn't want to have that sort of work environment, because again, it's a high pressure environment and it's pretty short lifespan for an emergency vet, not lifespan, short career, because you don't die, but they don't, and
listen, young vets.
but certainly it certainly lends itself to burnout with night work and all of that. So I really wanted people to say, look, I'm not up to it, I want to get off. Or I spend a lot of time trying to find solutions for that, having backup vets on call on a second roster to come in. But the practicalities is I couldn't quite get there. But I think if we all work towards that, to say, well, how can we make it more acceptable for people not to come in when you're sick? Because we don't. I certainly, it's been a while since I've been in the UK, but here in Australia, nurses will call in sick when they're sick. Vets will not. They come to work because they don't want to let their team down, which is admirable. It really is, but it's also harmful probably in the long run.
We also need an education of not just this is not a vet thing, it's a human thing, because we also need the clients to understand.
Yeah.
If we phone and say we can't do the consult today because the vet is sick, that is genuine, and that actually if someone is ill, they literally cannot do their job. So therefore we have to have understanding, and that's not just a veterinary thing, is it? I mean, we all get upset if an appointment's cancelled because someone's not well, or someone doesn't turn up to do a job and they say they weren't well. We have that mentality as humans that, what do you mean you weren't well? It's like, are you dying?
Yeah.
Because if you weren't, you should have been here cleaning my lawn, or doing my guttering, or whatever it is that you've got someone coming to do. It's like, well, are they really ill? Like, are they ill enough to not be here? So that's not just a veterinary thing. I think it's a human thing, and maybe that COVID will make some difference to that.
Excellent. Sarah, how are you for time? I've got quite a few more questions, but I want to be respectful of your time and not just keep yabbering away. I have many friends who say I talk too much. So I want to, if you're all right for more questions, I want to change tack a little bit. So other than a behaviorist, you're also a business owner. You run this business, and I was Googling your business the other day, and I saw something on there that's really interesting, and I think a great idea. Am I correct in understanding that you run a subscription service for vets where they can access you to pick your brains really on cases?
Yeah. We have, it's called the Behavioural Advice Subscription Service. And basically you can join at different levels. So it's open to general practices. And the different levels give you different levels of contact. So you can have just email contact, and you can write up to being able to send in videos of cases and histories for us to look at. And then we also offer a stress audit service. So as at the higher tiers of membership of that service, we'll come and do an annual stress audit within the practice.
Okay.
So yeah, we've got a number of practices now who are members at varying levels, and we use that for giving right from generic advice at the lower levels of subscription up to much more specific advice at the higher levels.
I think it's such a great idea for any specialty to have that, because I'd imagine before you had that officially, you'd still get people phoning you for a heap of advice, and then you're handing out free advice. But so obviously great from a business perspective, but I actually think from a GP vet level, it's really nice, because I would often have situations where I would love to phone the specialist, but I feel bad to phone because I don't want to waste their time. But we didn't have a system in place where you could bill me for your advice. So I think I think the subscription is an excellent idea. Is it working well? It is. Yeah,
it does work well, and we have Some practices obviously use it a lot and we get to know very well, and other practices that use it occasionally. Some members of practices as well, we find that one particular vet out of the whole practice is always the one who's behind the messaging. But yeah, I think it's something we've set it up a few years ago, and I know that Matt Gurney, who I've spoken about before, is a chronic pain specialist in the UK. He's just set something similar up for chronic pain. Or I think it's actually because he and his husband are both anaesthesia analgesia specialists, and I think they do it across the whole spectrum of anaesthesia and analgesia. But a similar sort of idea that you can subscribe and then have different levels of information. We give discounts on webinars to members at different levels as well. So when we run our CPD that we do through the practice, that if you're a member of BAS, as we call it, the Behavioural Advice Subscription Service, then you get discounted webinar access as well. So trying to encourage CPD as well. It's not just about, ask us and we'll solve your problem, but also we'll try and get some more education for the team as well. So that's another part of it, really.
That's really brilliant. I really like that. I'd love to see more of that in other specialties as well. Yeah. I think it'll take a lot of pressure off the poor specialist. I imagine there's a guilt thing about you want to help your colleagues, but you also go, well, this is my time that you're utilizing.
You're aware that especially in behavioural medicine, I guess, that there's a limited number of places they can get that information from.
Yeah, of course.
People want that information, but there's not quite so many avenues for getting it. But I know I've spoken to other colleagues, neurology specialists as well, who also have the same, who want to be able to help more. So yeah, I think it is something that might become popular in other disciplines as well.
Excellent. I'm looking at the time, and we should probably start wrapping up. I'm going to ask you a few last ones. One more behavior related thing. If there's one thing about your field of specialty or about your work that you could magically get into the heads of all the veterinarians who you deal with, or all the vets out in the world, an attitude or a belief or something about behavior, and whether that's clinically how you're treating your patients, or that you could change, you could say, okay, everybody now knows this one thing. Is there anything like that you would love to have people to know?
I honestly think my main one is that non-human animals have emotional, cognitive and physical health.
Okay.
That those three things are not divorced from each other. So when you're looking at a physical health problem, remember that animal is feeling something and thinking something at the same time, whether you're palpating it for a painful lesion, whether you're preparing it for anesthesia, whether you're looking after it in recovery after surgery, that it's not just, a cruciate repair, it's a dog with a cruciate repair who is feeling something and who is thinking something, and that is important because it will impact on their physical health as well. So it actually is important to you as a vet that you understand that is an animal, it's not just a leg. I remember when my youngest child was very, very sick as a baby, and I spent an inordinate amount of time in hospital. And when I was there, one time when he was very sick, there was a lady in the next room. We were in single rooms with our very sick children, and she had a child who'd had a really bad comminutive fracture to his leg, but whilst in hospital had contracted pneumonia at the age of about 4 or 5. And I remember this particular day, the surgeon came to visit him in his ward, and they put the x-rays up on the screen on the viewer, and he looked at the x-ray and he looked at the leg and said he can go home, and walked out, and he's sitting there with an oxygen mask on his face. And the leg is attached to a child.
Yeah,
it's not a leg. And I think that is what behavioral medicine does. I think it makes you remember it's an entire patient. It's a whole patient. It has physical, emotional and cognitive health, and we are the healthcare specialists for non-human species, and that means we should be cognizant of the whole triad all of the time.
I feel like this should be where I make a joke about surgeons, though.
Yeah, when I was spending all those times in hospital, we actually had a game, us mums who were constantly in hospital, and we used to play spot the surgeon. So they came through the door onto the ward. There was a little passageway of about 3 minutes walk, and during that time you had to decide if it was a medic or a surgeon before they got on the ward. We got very good at it.
I'm gonna defend our surgeons in veterinary science and say no, they're different. But and what about, so you took that's addressing everybody else's thinking. What about yourself? Has there been anything that you've changed your mind about in the last 5 years, or even if it's 10 years or so, something you used to,
all the time.
something that you used to believe and that you figured out and went, oh crap, I was wrong on that.
All the time, yeah, because we're learning every single day. I, as many people who work in behaviour, once talked about dominant dogs. So yeah, that's a massive change. Yeah, and I, at one point, had less understanding of this interplay as well, and used to think more in terms of cognition being separate. And so yeah, I mean, learned huge amount. And I think the day you stop learning is the day you have to retire. If you're not learning anything, you shouldn't be doing it. It's an evolving thing, and every single time you're with a patient, every time you're with a new client, you learn something about how to do things better. The sink analogy I developed in 2010, but I've developed it, and it's an evolving concept, and it's not something I developed in 2010 and that's the way it stayed. It's constantly changing and constantly adding to it, or bits to it. I think, oh, that would make it easier to understand. I often call them my shower moments. That's my thinking time. Standing in the shower, oh, that's a better way of saying that. So yeah.
I came across this sink analogy when I was reading up about you. Do you mind if I put it? It's a brilliant explanation. Is there somewhere that I can find a link to it that's open access that I could put in the show notes for people to look at?
It's in the process of, I keep saying this, in the process of being written up, because I work too hard and don't write things up. But if people want to contact me to get information about it, then that's absolutely fine, and we can send out the diagram. But yeah, it's I do need to write it up properly, and then there'll be a link to it. That's what we need.
Do you know there's a YouTube video of I think it's a vet actually who's drawing it, and she credits you. She says this is Dr. Sarah Heath's. There's a little video where she's drawing little sinks in there.
You should send me the link to that.
I will. So you can.
One of the things that you said at the beginning about the fact I've been around a long time and I am old, and
I never said it. You said it. I never said it.
One of my problems with that is I'm not very media savvy, as in social media. I'm really not very good at that. I have Emily in my practice who's trained in social media, so to do things for the practice, but I am absolutely terrible at it myself. So I live in this bubble, unaware of what's going on YouTube and unaware of what's going on Facebook. So, and in this little bubble, shielded from the social media world.
Unfortunately, I think I'm in the in-between group where I know that I should, and I do try, but I also don't quite get it because I'm a little bit too old. So then I just bumble along and do bad social media, which is even worse. All right, let's wrap it up with our standard questions. This has been amazing. It's really you say so much that resonates. The other, I'm going to jump back what you said there about once you stop learning. That's one of the other key things that I'm going to make a list of the key things that happy vets have. And it's human connection and continuous learning. Never ever say, "Oh, I know enough." And it's one of the key things that seems to keep vets happy for much longer in their careers, is that attitude towards learning. So I love it. Thank you so much. Do you listen to podcasts? If you're not media savvy, are you a podcast listener?
Yeah, I listen to the Anfield Wrap. The Anfield Wrap is a Liverpool Football Club podcast. So I listen to that, all the pre-match build-up, all the post-match analysis. So yeah, I do that. And then another one is a girl called Holly. Oh, my short-term memory is going to let me down now, and I'm not going to remember. But Conversations of Inspiration is a lady called Holly Tucker, and she interviews people from various walks of life, just about what they've done in their life and why they've done it. But also at the end of it, she gets them to write a letter to their younger self. So it's what would you tell your younger self about how you would do things differently, or what you've done, or whatever. I just find those really fascinating. People from the Body Shop and Joe Malone, some of them in business, some of them in charities, some of them nothing to do with veterinary, just life things. Yeah, so I like those. But I must admit, my main podcast is the Anfield Wrap.
That's the second football, almost it's soccer. That's the second football podcast we've had from a guest. One of our previous guests, his favorite podcast was not Liverpool, though. I forget what it was. Anyways, it was definitely not Liverpool. So you're in good company. And then we wrap up with a very similar one to Holly Tucker. Instead of a letter to your younger self, you are at a conference, and it's a Zoom conference, so because it's 2020, and you've got all the veterinary new graduates of the world listening to you, and you have a couple of minutes to give them one bit of advice. It doesn't, not specifically vet or behavior related, any advice, but what do you tell them? What thought do you leave them with?
Wow, that's a difficult one. Yeah, I guess never stop learning.
Yeah.
Probably be it in a nutshell. Just always be open to learning, and probably don't do what I do, and be better at self-care. So that's probably been my biggest obstacle throughout my life, is that I'm not good at that, and that has implications. So yeah, look after yourself. Believe that you can do whatever you want. You can believe in yourself, I guess, which is a bit pot kettle, and my children, if they ever hear this, will be laughing their socks off. Go, Mum, that is so not you. But yeah, I guess that's the thing I've learned. And if I was selling someone else, I'd say, yeah, if you do look after yourself, then the other stuff does follow. And sometimes doing it the other way around can make life hard.
It's important to hear it from somebody, because it becomes a very trite saying, self-care. But to hear somebody say, like, I'm not good at it, and it has consequences. So we don't just say it, we mean it when we say practice self-care. Well, the first part is recognition of that fact. So at least you've recognized it. Now, how are we gonna get better at self-care, Sarah? Sarah, thank you so much for your time. It was way beyond behavior. I think there's so much wisdom in what you do and what you've learned in the work that you do, that I think you don't have to have any interest in behavior to take a lot from this conversation. Thank you, really. That was brilliant.
Oh, thank you. Thanks very much. Everyone just take care, stay safe and well, and yeah, let's hope 2021 brings better things.
Here is a quick question for you. How many online courses have you subscribed to in the last year that you've never quite finished, or maybe never quite started? Or if you're like me, you're feeling that you should be doing some ongoing learning, because now that we have no more conferences, you feel you are falling behind and not staying up to date with what's best for your patients. But you just can't quite bring yourself to commit. I get it. You work hard, you have other interests, your time is precious, and sometimes the last thing you feel like doing is staring at yet another screen or textbook, especially staring at more vet stuff, which is why we're making the Vetworld Clinical Podcast. I wanted clinical content that I could listen to in my car, on the way to work, or on my run, or while trying to drown out the noise from my kids. I wanted a podcast that was fun to listen to, that was not too boring, that was not just someone reading an article, and something that would keep me engaged enough that I'd learn at least one or two new things every time I listen. And I wanted to choose the topic I listened to. I couldn't find this podcast, so we decided to make it.
We've been partnering with specialists from all around the world in small animal medicine, surgery, and emergency and critical care to bring you concise, highly valuable, highly practical podcast episodes. And if you don't mind me saying so, we both think they're pretty cool. I learned a lot. I learned a lot today, Dave. That was super cool. So when you're ready to lift your clinical game to a new level, go check it out at vvn.supercast.net or click on the link in our show notes. If you subscribe before the end of January 2021, then you'll get your subscription at a 30% off early bird rate forever. And if you're ready to commit for a full year, you'll get an additional 30% off. So go to vvn.supercast.net. So that's VVN for Vet Vault Network, and sign up now.